So back to our endocrine system series. Today we are going to be covering part 4, the parathyroid hormone. And here again, I'm Mrs. Caroline. I'm a licensed registered nurse, and I'll be taking you through this very important topic. So 1, the parathyroid hormone is secreted by the parathyroid glands, and this helps with the regulation of calcium levels in your blood. And also we should note that the parathyroid gland is responsible for the control of phosphorus and vitamin D levels in your body. The calcium in blood has an inverse relationship with phosphorus. So that means that when the calcium levels are high in blood, the phosphorus levels will be low. And likewise, if the phosphorus is high, the calcium will be low. So what are the conditions that we get when we have too much or too little of the parathyroid hormone? So if we have too much, we get hyperparathyroidism, and if we don't have much, we get hypoparathyroidism. But before we start, how beneficial is this parathyroid hormone to our bodies? So your parathyroid gland releases the parathyroid hormone when your body detects low calcium levels in blood. The parathyroid hormone regulates the calcium levels by affecting the following parts of your body. So it's not a one-man's function. The whole body is involved in regulation of your calcium levels with a control of the parathyroid hormone. So to the bones, the hormone stimulates the release of small amounts of calcium from your bones into the bloodstream. In your kidneys, your parathyroid hormone enables the production of active vitamin D, which is also known as the calcitrol, in your kidneys, and also this signals your kidney to retain calcium in your body rather than flushing it out through urine. For the small intestine, the hormone signals your small intestine to absorb more calcium from the foods that you eat. So, what is the relevance of having calcium in our bodies? 1, we should note that it's one of the most important and common minerals in your body. And most of the calcium is stored in your bones, but you have, and it's needed somewhere else. For example, in your blood, there should be a certain amount to keep your blood in a normal condition. So, what are the importances of calcium in your body? 1, calcium is very vital for the nerves to work. For any kind of impulse firing, we need calcium as an ion to get involved. It's very helpful in making your muscle to contract, and that enables movement. Calcium is also very important in controlling your bleeding. It's part of the clotting factors that are relevant in the clotting cycle. Calcium helps your heart to work properly. Like I said, it has a lot of work with the muscle and the nerve function. And so likewise with the heart, without calcium, even the contraction and the nerve impulses may be inhibited. So let's look at our first condition where your body is secreting a lot of the parathyroid hormone. So in this case, it's what we call the hyperparathyroidism, where you have excess hormone causing to an increase in calcium levels in your blood. So for most authors, the normal range could be between 9 to 11, and the easiest way to cram it is called 911, 9 to 11, 911. However, some books quote 8.5 to 10.5. So what I consider to be hyperparathyroidism is when you have levels greater than 11 milliequivalents per liter. So how do these people present? 1, they'll have loss of appetite, they'll have hyporeflexes, they'll have dysarrhythmias. To be specific, they'll have shortened ST segments with a widened T wave. they'll have constipation, they'll have nausea and vomiting, they are more likely to form kidney stones, they have increased thirst, they have fatigue, they have muscle weakness, and of course the landmark is calcium greater than 11. So one thing I notice about hyperparathyroidism is that everything slows down. So you find that if there is slowdown in your reflexes, you have hypo reflexes. If there is a slowdown in your GIT, you'll experience loss of appetite, you'll experience constipation. And then if, for example, we have a lot of calcium ions, they're more likely going to form complexes that can lead to kidney stones. So hyperparathyroidism, more calcium, everything is slow. Everything slows down in your body. So you need to note that. So let's look at our management for hyperparathyroidism. And just like we've noted with all other endocrine disorders, one of the major intervention is surgical removal of that gland. If the gland is over-secreting and there's an option of removing part of the gland, it's usually one of the management. So in this case where we have 4 parathyroid glands, they can do a partial parathyroidectomy. Maybe they can remove that 2 and then leave the other 2 to do the remaining functions. So however, if you're doing a partial parathyroidectomy, you need to monitor for rebound hypocalcemia. 1, we know that there were 4 glands doing this function. However, you removed part of the glands and you're left with fewer than the normal. So there is a possibility where you will have less secreted hormone than the one that was secreted before, causing hypocalcemia. The other management is administration of calcitonin. Calcitonin is a hormone that is produced by the thyroid gland in response to high calcium ions in blood. So this helps reduce the calcium ions by increasing bone absorption of calcium. The other management is to eliminate any kind of calcium given intravenously, also to avoid calcium-based antacids in case someone is taking those, but in extreme cases, a renal dialysis can be performed. So after looking at our hypersecretion of the parathyroid gland, we need to look at the hyposecretion of this hormone, a condition called hypoparathyroidism. And here there is low production of PTH by the glands. That means we'll have low calcium concentration in blood, but in turn have a high phosphorus concentration, because calcium and phosphorus have an inverse proportion relationship. So one of the things you need to know is the major assessments for hypoparathyroidism. So here we are majorly looking at the symptoms that are caused due to low calcium levels in your body, in blood. So one will experience shortness of breath, you have tingling in your extremities or numbness, you have muscle cramping, you have fatigue, someone will present with poor memory and concentration, you have increased bowel movements, you have hoarseness of voice, you have bradycardia, aches in your bones and joints, you have hyperreflexes, and then you also experience bleeding disorders. So literally, if we have low calcium, our body is overstimulated. That's why sometimes we present with the above symptoms. So these are must to know, the major signs in hypoparathyroidism or in hypocalcemia. The Trousseau sign, which refers to the involuntary contraction of the muscles in the hand and the wrist that occurs after the compression of the upper arm with a blood pressure curve. So this can only happen if someone has hypocalcemia. The second one is the Chvostek sign, which refers to the twitching of the muscle, the facial muscles in response to the tapping over the facial nerve. So you just tap just in front of your ear, near the facial, just at that facial nerve, and someone you see them twitching around mouth areas because of that, and when you see that, it's a Chvostek sign. So when you see these two signs, these are major indications of hypoparathyroidism or hypocalcemia. How do we manage these patients? So one, you need to manage, if they don't have the electrolyte, you need to give them that electrolyte. So manage the electrolyte imbalance. Give out calcium, iron supplements. You need to give phosphate binders, because we say that in hypocalcemia the phosphorus is high. So the phosphate binders will help us get rid of the high phosphorus levels. However, as you're giving these phosphate binders, you make sure that patients take these in the morning on an empty stomach at the same time, and after taking them they should sit up for 30 minutes after ingestion. So to all my subscribers, to all those that have been watching my videos, I want to thank you so much for watching. Please, if you haven't gone ahead to subscribe, there will be more content, more systems to be covered. For those that plan to do their exams, I got you covered. So next we shall be looking at our insulin hormone, where we'll look at our complications of diabetes, where we'll look at DKA and all other things. Again, watch, like, share and subscribe. Life with Nurse Carol. Love you all. Thanks for watching.